Good afternoon, everyone. My name is Sharon Fon. I'm a professor of public health at the University of the Witwatersrand and also a visiting professor at the University of Gothenburg in Sweden. And I have had the enormous pleasure of being the co-director of the Consortium for Advanced Research Training since its inception. I think we started working on it as an idea almost 15 years ago, and we carry on. And it has been a wonderful experience to learn from my colleagues, my students, and the people that we engage with. I know that, Rita, if there are any questions that I don't see, or if you can't hear me, I'll expect you to interrupt. So I'll just check with you, Rita.
Yes.
I'm good and audible, right?
Yes, you are, Sharon.
Excellent. Okay. As usual, we sometimes have glitches when people have to connect. If that happens, we'll find an intelligent way to deal with it. Today's session is writing and communicating science to non-scientific audiences. And this is really important because for those of us, particularly in public and population health, but actually in all fields of research, it's really important that people understand more than just us talking to each other, researchers, understand the research that's going on. And it's a skill that we as researchers don't necessarily have, or if we do have it, we could do better than we do. And so we really have to effectively communicate our research, how we do it, why we do it, and what we find to a range of audiences, from policymakers to the people who we're doing research with, and the people who the policy might affect. And so it's really important that we learn how to communicate in a way so that when decisions are made or services are changed or policies are made, people understand the evidence that those decisions are based on. And it's something that we saw really during the COVID pandemic. So, for example, I think a lot of people didn't even know there was something called messenger RNA, or a variant, or mutation. But since then, we've learned that even basic science research can and should be effectively communicated to everybody. And so we've put some effort into that. And today we are very fortunate to be able to have with us three people who have some experience in doing research and in communicating that research and in trying to improve their own skills in that communication. And we are going to be able to hear from them what their experience was. So I'm going to start off introducing them one at a time. So Dr. Karani Maguta, can you put on your camera? Great, there we go. Just to tell you a little bit about him, thanks so much for being here. I'm going to be looking down because I don't want to get anything wrong. And this part I'm actually reading. So Dr. Maguta is from Moi University, Eldoret, Kenya, where all the runners come from. Karani is an epidemiologist and he's a medical physiologist, and he has a special interest in non-communicable diseases of lifestyle. His research looks at the effect of different kinds of exercise, what you do, how you do it, how much you do it, how quickly, how often, those kinds of things, the effect it has on metabolic syndrome, which really is the precursors that lead into three very, very important epidemic diseases on the African continent: high blood pressure, high blood sugar, and what we call dyslipidemia, which is actually the amount of bad fats that we have in our blood. He's got a very keen interest in policy change approaches and he has a quest to mitigate lifestyle diseases through behavior modification. He holds a PhD from the University of Nairobi, and he teaches at the medical school at Moi University. He's an alumni of the German Exchange Service. A lot of you will know the acronym DAAD, D-A-A-D. He's a graduate of the Consortium for Advanced Research Training in Africa, and he's also an alumni of the Policy, Advocacy and Communication Enhancement PACE program, where he had training in September 2021. I'm sure that was online training. So someone who is doing work in a very important area. We're both policymakers, but if you're going to influence people, the man or woman on the street needs to know about him. So thank you for joining us. And Karani, if I may, I'll call you by your first name, if that's okay.
That is okay, Sharon. Thank you.
Great. The second person we have with us is John Ayodele Elonge, and John is from the University of Ibadan in Nigeria. He's a lecturer at the university, and he's a librarian at the University of Ibadan. And he has a deep interest in emerging technologies in libraries, archives, and records. And this has become quite an interesting field because it's become sort of the cutting edge. What with big data, meta-analyses, librarians play a very, very important role. So he's interested in libraries, archives, record centers, health information systems and health communication using published studies. He's also got an interest in what people are calling new media. I'm sure he'll explain that to us later. And during the COVID lockdown, he led a social research project to study the experiences of researchers during COVID-19 and how they managed to do research under those conditions. And he's also a Carter graduate. And then our third panelist, Nkosiyazi Dube, seems to have gone off my screen.
He seems to have dropped off.
I'm sure he'll rejoin. I did notice he fell off once before. It could be, we're having a lot of load shedding here in South Africa at the moment, and it might be changeover between, if he's at the university, between the generator. But he's our third panelist, and I'll introduce him anyway, and he'll say hello when he gets here. He's from the University of the Witwatersrand in Johannesburg, South Africa, and he's a lecturer and the Deputy Head of Department in the School of Human and Community Development, the Department of Social Work at WITS. His research interests are in health and social development, with a specific focus on social protection and social security, both formal and informal. He also has done work on children and HIV and AIDS. He's just conducted a study, well, it's quite a while ago now, where, oh no, this is a brand new study built on his PhD. He conducted a study that was investigating the feasibility of using informal social security networks. They're called stokvels, which are very, very old community saving clubs, I would say, in South Africa. They have a very, very long history in South Africa, and I'm sure in the rest of Africa. And he's tried to use those naturally occurring networks to study, to do hypertension screening, because they're often women and they're often older people who are part of these networks, to look if he could use them as a way of reaching people to screen for high blood pressure. He's a member of the South African Council for Social Service Professionals. He's a Carter graduate. He's also a PACE alumni, and it's a pleasure to have him as well. Oh, good, you're back, Nkosiyazi. I've done your introduction. So welcome to our panelists, but also welcome to the people who've joined us. Very, very nice to have you with us. I'm going to try and get our panelists to talk us through what they've learned in their research career about communication, how they've disseminated their work, how they've engaged with the wider public and with decision makers. So what I'll do is I'll just do some questions and answers with each of them. If you have any questions yourself, please use the Q&A function at the bottom of your screen so that we can also get your questions included. And then towards the end, I will come and let the audience do one of two things: share for us your successes, and also let's not be scared to share our failures. It's probably where we learn the most. And also to ask any questions. So Karani, I'll start with you as I introduced you first.
All right.
You've been interested, as you said in the introduction I read, in seeing policy changes. So what strategies have you used and have you found to be helpful in trying to communicate with a non-scientific audience?
Thank you, Sharon. Yes, I have done a bit of work. I have engaged with different levels of individuals who belong in the non-scientific audience. And what I have learned, and which I keep learning, is to appreciate that researchers and policymakers, or individuals who are non-scientific audience, even if they are not at that very high level of policy making, do not speak the same language. As scientists, we often have big words that we use to advance what we want to communicate. You want to talk of the variables that I used. You want to talk of big terms like p-values that I got from this work, bias or recall bias, big words that mean a lot in science and that we can communicate with when we are talking with our peers, but which the non-scientific audience may not understand or doesn't even care to really understand. So what I have learned is to keep it simple, to know my audience and keep it simple. And because I am the scientist and I'm the one who understands the message I want to pass home, the consequences of missed recommendations that I would want the population to get, or the policymakers to get, or all levels of my audience to get, I keep it simple. I become the one who bridges the gap between the high-level scientists, where I place myself at such a point because I'm the one who has come up with the work, and the individuals I want to reach out. I learned this the hard way, Sharon. Actually, you have encouraged us to share where we have failed. I learned this the hard way a few years ago, where upon completing my PhD about 4 or 5 years ago, one of my mentors then invited me to join him in a function where he was going to give the keynote address. Now, the keynote address is an important bit of a conference because it sets the theme and causes everybody aligned into what we are going to be discussing. So you come up pretty fast or pretty early in the discussion. And so I hadn't done any before. I knew it was an athletics conference, actually the first one in this larger part of the Eastern African countries, and it was a global function. And so it was exciting for me to be drawn there. I was happy to go there, and I did my very good slides, very scientific from my PhD work. My mentor, when he was asked to go and give his speech, just carried with him a simple book, a pen, and a book. And I sat there because he hadn't called me, wondering what it was that he was going to speak to this audience that was mainly made of retired athletes, current professional athletes. We had people from the Ministry of Sports. Actually, our own minister from Kenya was there in that audience. So we had a good grouping to disseminate science too, our findings. And he was my mentor. So he talked, and as he talked, he basically just gave his experiences and how he has picked science over the years, but in a very simple way. He's a sports scientist in a way that the athletes, most of whom don't have higher education, would pick. The minister who sat there, who is not a scientist, would pick. A few scientists who were there would pick. I felt a bit challenged and I couldn't quickly change my slides because he was going to call me shortly thereafter to continue with his speech. So when I stood and with all my big PowerPoint slides, I didn't know how to go about this. The beauty though, the very first slide I had this old man who was in running wear and running. And I chose to concentrate on that because that would identify, or many people would identify with that. And I tried to collapse all the other things that I had prepared in my slides to have the message captured in this. But yes, I learned that I had not done my homework well. I didn't quite understand my audience. I lost on an opportunity where I would have really advanced so much to professional athletes, to the minister and his team coming from individuals who make policy. I learned quite something. So Sharon, when you ask me what I have learned and what strategies I'm now employing, I have learned a simple thing: keep it simple. Do your homework. Know your audience. I have a few other things I may have picked, but I wouldn't want to take it from my colleagues. I can post there. Sharon, thank you.
Muted. Thanks, Karani. I think that's incredibly important. And well done for thinking on your feet when you were faced with an audience and you knew you had the wrong approach. I think that shows quite a lot of skill. Keep it simple, know your audience. And I think the other thing that you actually said was tell a story. Make what you're saying the message. Be clear what your message is and tell people a story they can relate to. Your point about identifying with the picture of an older person running. I think that was very meaningful. Have you worked at all with newspapers or media? If you have, do you think they're useful? What's your sense of, so you've told us about standing in front of an audience. Have you ever used written form, and how useful, important is that in your experience?
Yes, I have some experience. I am still a young scientist, so I'm still gathering quite, but I have some experience, and probably now that I just used the previous example in this keynote address that my mentor then and I gave, I could use what we picked from there because we engaged a bit with the media. Now, as I said, I had failed on my approach because the minister and such offices command a lot. We had media personnel in there. And because we were coming in quite early to set the pace of the conference that was to take 4 days, we were quite focused on. And they really focused on the experience of my mentor, but also picked on what I presented, and it was put into the e-space. It wasn't like in the mainstream newspaper, the print or such, but it was quickly captured on Twitter and onto the e-space. And as usual, because people keep checking what is propping up and all that, you see people starting to engage, and it was exciting. Of course, when you sit back and now you are looking at what you have done, and you're also seeing a bit of this prompts coming on what is happening, it was exciting. I, however, noticed how quickly we fail to communicate the right thing, or how the media fail to capture what you are mentioning or what you are saying, so that it is either I have not communicated the right thing or the right way, or the media persons are not well trained to grasp this scientific message I want to pass. But of course, it also zeroes down to, I haven't simplified it in such a way that they could pick. So I noticed quickly that there was a bit of miscommunication, and having been the person who was delivering this, I was able to engage back. But social media moves so fast, Sharon, so that the moment you have had the first 2 or 3 people comment on that main medium used by the media station, they mislead everybody else who is following here below. So that you see, when you failed it the first time, or when the first person failed to capture the right thing, and you didn't quite correct it immediately, the message that passes is so lost. I learned that. I now know better. I know how to, as I said, try to communicate in such a way that you do not lose it, and in such a way that you make your research findings identifiable with, as in people are able to quickly pick what you want to pass without having to really struggle so much. So that's what I have picked, Sharon. Thank you.
Thanks, Karani. John, let's move on to you. Karani's already introduced us to 2 outlets, one a big policy and practice engagement. The other, he said, was on the eSpace, Twitter. In your experience, John, or given your vast knowledge, what other outlets are there to engage people, and what do you have to say about them? John, you're on mute.
Thank you very much, Sharon.
Okay, great.
Thanks for inviting me to be part of this team. Hello?
We can hear you, that's good.
Yes, we have many channels or many platforms where we can use to disseminate research findings. And I would say that the best now that we use is new media. I know when you were introducing, you said new media. And we say new media is the world of the social media, a channel that is available to everybody. There's a concept which I learned when I was working as a librarian in the library. It's called Library 4.0, which we got from Web 4.0. And also we can call it Research 4.0. The major idea behind 4.0 is taking the library to where the users are. Also, we can apply this to the research, taking research to where the users are. The users are not in the university. We are the one dishing out the ideas. The users, the implementers, they are in the government house. They are on the road, on the streets, in the villages. So when we have a research and we keep it in the library, it will not work. So we have many platforms like Twitter, which I've really used extensively to disseminate research. And also there's one, Facebook. Everybody knows Facebook for socialization. It's beyond that. It's beyond that. I did a program during COVID-19. I did a research. That research, majorly the disseminating aspect of that research was done on Facebook. It's called Chronicles of Researchers in COVID-19. We had videos of researchers, and after getting those videos from different countries, from the South, from the West, from the Eastern Africa, and even outside Africa, sharing their experiences. You know, I've done a paper on that, but that paper was not popular as what I posted on Facebook. That is one. Apart from Facebook, another one, which is we don't really look at most, is the issue of YouTube. YouTube is a very beautiful platform to share research results or to engage with the policymakers. People don't know. They believe that YouTube is just for us to go and watch videos. You know, there's one organization in the Western world, you know, they did a competition known as Dance Your PhD. Dance Your PhD. You know, and the focus of that Dance Your PhD, is an example I want to give, is that they are trying to communicate science, you know, to non-science audience in form of dance. And when I saw this, I got this information through Qatar. I participated. I got my students together. We danced together. I can even share. Let me just share how it looks. And with this, we dance the message of that work. No matter how very complicated your work is, You can dance it. And that was the major reason why those people are doing this. And many people, very difficult, even me that I'm a social science person, there's some ideas I got from that Dance Your PhD that is helping me today. So this is it. You know, it's called Dance Your PhD, Social Media for HIV and AIDS Information Communication by Dr. Alonge. You know, he's talking about, that is it, the students, they are dancing. And the message there is showing that when to get information about HIV and AIDS, you can, or if you have the maybe you want to know more, you can go to your social media, you can go to your phone to find out about this information. And through that video, it's a short video, less than 5 minutes, and we have your 541 views already. It was posted on 20th January 2022. You know, with John, that, I was able to communicate the ideas. Are you showing us? Yeah, I will share the link because of our time. I will share the link of that video. So that
okay. Yeah. Because on your shared page, we don't have we have something else, but share the link in the chat. That would be fantastic.
I'll share it. Yeah. So apart from that, let me also give another example. Is Twitter. People don't know that Twitter is the key. The government officials, everybody, they are getting instant information on Twitter. That is another one. And again, all those people that you cannot meet one-on-one physically, or if you send email to them, they will not respond to you. They will respond to you if you tweet about them. If you hashtag them, they will listen to you. You know, recently also, I also did a program whereby we talked about HIV and AIDS on the World HIV and AIDS Day in December. We did something like that as well. And recently also, we also engaged our government about reading culture, you know, and I use Twitter Space is a new one now. Twitter Space is like a radio whereby you can speak and people all over the world, without you paying, you know, it's free of charge, people will listen to you. And one advantage is that it can be recorded and share with other people. There are so many. If I start counting, we will not stop. I will share some of them on the chat room for you to see. Thank you very much, Sharon.
Sharon, you're muted.
Sorry. Honestly, I should be better than that. And Nkosiyazi, I'm going to come to you. Thank you, John. I'm going to come back to you. But I just want to bring Nkosiyazi in. So you've been working for a long time and your interest is in health and social development. I'd like you to share with us ways you've practiced communication, or if you've got other examples of the way you've seen others practicing communication beyond communicating with the scientific audience. Welcome.
Thank you, Prof. And yeah, thank you for the invitation and thank you for the question to share some of the ways. Yes, like you introduced me as somebody who works within the informal social security systems and working mostly with the women who are part of the stock force in South Africa. So I have kind of realized a few things. Or I've learned some of the lessons through, you know, sometimes you kind of made it easier for us that even not so good, we need to share. That, you know, sometimes when you come in or you get into some people's space and you think you are the Mr. I know it all, sometimes it's very problematic. I learned that before you enter into a particular space, I have to understand that, yes, these are people in the informal sector, but they have some knowledge of some of these particular things that happens around them. So you start from where they are. I get to know what is it that they know about this particular disease, especially the hypertension. So in this study, what really intrigued me was the fact that when I was doing a part of my data collection, they lost one of their members, and this member just slept and she never woke up. So when I heard that, because of the issues of cultural beliefs, the systems, And sometimes within the African context, we believe so much of witchcraft, the jealousy. Then that was the rhetoric amongst most of these female members that, oh, maybe because she recently extended the house, so that's why people were jealous of. So then I thought, okay, yes, you know this, and I respect this. This is your culture. This is your practice. This is part of your belief systems. But have you ever thought of this other thing that also can be a silent killer? How can I then introduce this to you? So that's when I then started to think, well, okay, they know this, they've been doing this, but these things continue to happen. So that's when I then said, okay, let me then see if we can use these platforms just for hypertension screening, especially for these women, so that this is something that is slowly introduced into their system. This is something that they really don't think about so much. We are fine, I'm healthy, I'm what, but I'm healthy before I get to a hospital. One of my mentors used to say, you know, if we can get into a particular ward, you might realize that sometimes you can test for something and they will never release you. You might find yourself admitted while you thought you are very much healthy. So I saw that, Prof, I think it's really problematic when we go in and we display our knowledge instead of also acknowledging what is already in the space. And the other thing that I also learned was that, you know, sometimes when it comes to this science, when we write for ourselves, we tend to include a lot of jargon because we want to feel fancy, we want to stand out, we want to have introduced this concept. But when it comes to the people where we get this data from, these deep rural areas, we need to simplify this. We need, I like the fact that John dances, you know, to pass a message. So within that particular space, sometimes it's simplifying this language and also having some other instruments that are made in the person's mother tongue. So the translation of the instrument does not just stick to English. So that was my one other learning thing, that, you know, sometimes it's best to understand the context and also to stick to the language of that particular environment so that people are able to read, or so that people are able to share their stories comfortable with their own language. So I think for now, Prof, what I have just seen also happening out there is that sometimes you come across of a pamphlet or a brochure, it's in English and no one can understand. So I just said, okay, maybe this is not the so good practice, but we can maybe try to improve this by at least making it in a language that can be understood by the rest of the community. Thank you, Prof.
Thanks, Nkosiyazi. I mean, I think you've said something, you've extended what Karani was saying. He said, know your audience, and you've added in, and I'm sure Karani means this as well, and respect your audience. That they do have knowledge, and you need to move from where they are to you learn something from them, they learn something from you. And I think that that's quite an important message. And so, and everyone has brought up in a different way the issue of language. It's also the words we use, but also the language that we use. So language in many different meanings of the word language. If your audience is Swahili speaking, then you should be communicating in Swahili, not necessarily in English. And it's something I always find it interesting when I'm a doctor, a medical doctor, and I so often hear that the patient is ignorant. And I always think to myself, who has been to university, me or the patient? And somehow the patient is ignorant. Meantime, it's me who can't speak their language or can't make myself understood. The ignorance is not with the patient. The problem is with me. And Karani, you said that as well in what you were saying. I'd like to ask each of you, and I'll start again with you, Karani, if there's, besides the school of hard knocks, making a mistake, is there any other training that you've done that you've thought has been helpful to you in learning how to communicate better?
Thank you, Sharon. Yes, I have gone through several schools experience. I recently took time to go through the papers I have done before and wanted to know which among the papers that I have done over the past couple of years has the widest readership.
Mm-hmm.
And you know, when you write, you know which paper you have put in the most effort. You want to put yourself in the shoes of the editor, and you almost think that this is a great paper, this is the best paper.
Mm-hmm.
I was surprised to learn from what exists already in the net that the papers that I thought were the worst have the widest readership.
Oops.
They have, they have caused me to be more visible. The papers that I thought were the best, and I put in a lot of science there, nobody reads them. I think you read the first sentence and it is already way out of you. So I have learned through that, so that it's been a school for me that, hey, when I approach it this way, I am able to get better audience. As you said when you started, I work in Eldoret, Kenya, where we have the real source of long distance runners. I have learned that by engaging with them, and especially because my work revolves around fitness, about heart health, and about all such things that are fitness. And these are the people who are always jogging in the morning, who are always in the gym, who you always watch on TV. I discovered that to meet that wider audience, who I may not sometimes reach, because among the audience I want to communicate to are decision makers, probably my local governor, probably the county director for health and such. They are fairly up there. I am here with my science, with all my research. It is mainly revolving around exercise and health and such things. I learned that by reaching out to these athletes, and who may come to me for professional checks and measurements of fitness, which I do, I'm able to reach them. And because they are known and their names are great out there, they're able to pass this message beyond me to the person above them that I could not reach. So I've been able to pick a couple of these lessons that I now know apply in causing my work to reach a wider audience. Yeah, so I've been able to go through a couple of schools, Sharon.
Interesting point, the idea of getting sometimes a face, a well-known face for your science, to help you communicate your science. And then, of course, the skill is to make sure they really understand it so that they can communicate it correctly, appropriately. John, you spoke about the dance, your PhD. You've just picked that up on the web. How did you find that? And are there others that you've seen or know about? How do you find places to learn where to communicate, how to communicate better? John, you're on mute. You're being like me.
Okay, thank you very much, Sharon, for that question. There's a lot of avenue where we can learn how to communicate. You know, I have a privilege to study information science, my first degree, library and information science. So with that one, I know information already. So Carter encouraged me to go further to do a PhD in communication, specializing on developmental communication. So with that alone, I have the background of communication and now going to public health. And with the training I got from Carter, I discovered that, you know, though we have sciences, we have public health issues and so on, but these public health issues cannot be understood if they are not well communicated. And that's the reason why I lay emphasis, or I lay very importance in developmental communication, which I learned when I was at the University of Nairobi. Subsequently, there's a lot of other free e-learning platforms where we can learn from. You know, apart from that, and also with the program I also got about 2 weeks ago under Qatar, I discovered that I can communicate to policymakers to engage them more, you know, and also strategy. And those lectures, those trainings, they are free. They are online. The platform, I will post some of the platform on here, whereby whether you have communication background or not, you can be an expert in communication or a policy engagement or research dissemination, just like Karani and Dube. You know, I learned from them a lot of platforms, and that I got those ideas from there. And also reading as well. If you go online, you read, you follow other people on Facebook, on Twitter, on your LinkedIn, on your ResearchGate. You see how people are using language to communicate. And that will take me to that question you asked then, the issue of the language. The language also, not only in terms of the language, geographical languages, even the platform is a language. If you are talking about a particular information, let's say abortion, or you're talking about smoking or cigarette smoking or whatever, you know where to go. Which platform are you going to go? Schools? You won't go to villages to talk about maybe where you can go there, then you go to the right place. Even on social media also, we have right place on social media. You know, if you're talking about, you want to address secondary school students, you go to LinkedIn, you will not see them. But go to WhatsApp, go to Twitter or Instagram, you can see all these people there. It's also part. The language and the platform determines how your message will be received, whether it's going to be received or rejected. Thank you very much.
Thanks. I'm going to actually, Nkosiyazi, I'm going to give you the question that has been posed in the Q&A, which is, what are the ethical considerations before you put your research findings on social media? And then a more nuanced part of that question is, particularly if your participants are children or other vulnerable groups. So what would be your advice to someone who, like, when can you put your stuff on Twitter, and how do you do it? And how do you know that you're not harming somebody, and how do you know what you're doing is ethical? What would you say as an answer to that question?
Thank you, Prof. I think when it comes to research ethics, that's one of the fundamentals of research. I would say before maybe engaging on social media with research, especially the findings, sometimes it's very key that these intentions are communicated in your participant information sheet, if you have some, so that your research participants will know that in future, this is part of your plans and how you are going to protect or maintain or contain confidentiality and anonymity when you kind of post those on social media. Because sometimes I see quite a lot of pictures, and then I ask myself that, was this child consulted? Is a minor? Did it pass through some form of research ethics? So it's not the willy-nilly that we just have to post anytime, because I have done the research and now it's my duty to disseminate the finding, but it's also our duty as researchers that we abide by those ethical considerations. We mustn't do any harm, do no harm, and it should be upon the agreement that the participants are also comfortable in this being published out there. Then if they are not in agreement, because I know maybe I will talk also within the VET context that when I do research with minors, those who are younger than the age of 18, already my ethics clearance will come from the main university ethics committee. So it's something that will come with some binding regulations or some protocols that I have to follow in respect of disseminating the findings. So I have to be clear on that. So if it's not part of my proposal or my protocol, and I did not include that, then I think when it comes to posting, I also have to think twice before I do that, because it might be an ethical concern. So I would really urge colleagues in different areas that before we post on social media, especially when it involves vulnerable groups like Sharon is saying, and also the minors, that we consider those, because sometimes we might be trying to do good, but we are harming somebody else. Somebody can see a picture and they can recognize the person. It's a very small world. So, and that can end up doing more damage than the good. So I think some of those things are also looked into very thoroughly, especially by reviewers of these protocols, to make sure that we are very clear as researchers on how we are going to disseminate, and we stick to those guidelines. We cannot expand because now I want to put this in social media. No, we have to keep to those guidelines. So I would say it's very key that it's something that is agreed upon. We respect the privacy and the confidentiality of the participants, no matter how old they are. If it's vulnerable groups, it's not something that is going to increase or exacerbate their vulnerability, but something that is trying to have a purpose out there, especially if it's out in social media. Thank you, Prof.
I think the other point that's probably worth making in this regard is you've got to do high quality research. So if you are putting out a one sentence, we know that, it's based on good quality research that has been peer reviewed. We've all seen this fake news that goes around and stories that people make up. And the world's actually become quite a sophisticated place, again, because of the COVID pandemic. Everyone will know the discussion about ivermectin. Does it or doesn't it work? And suddenly research methods, how you know what we know, is very important. Karani, do you have something to add?
Yes, I fully agree with you and Nkosiyazi. I happen to sit in our local IRB as a reviewer of research proposals. I have done that for a few years now. And we have noticed that with time and the advent of newer ways of disseminating research, which we always insist when you do your proposal and you hand it in, you must describe, among other things, how do you intend to disseminate this work? If you indicate there that, well, I'll have it published in a peer-reviewed journal and all that, but I'll also use social media, which we now encourage because it's a way to disseminate this, then you have to describe how exactly will you do this. And as Dube was saying, you have to talk of de-identification. You have to talk of, are you going to ever use any pictures? How will you do this if you ever did? So that it goes through very rigorous evaluation by an independent team for you to get this authorization. But yes, and I like the questioner, the person who put in this question, because we are basically walking from the traditional way we were disseminating research findings to more novel, newer ways that are easy reach for everybody. And we have to be very careful how we take care of the ethical considerations in that regard. So thank you, Sharon.
So another question that's come up is the question of what when you're doing something that is controversial. So you want to say something, your research has found it, but it's a controversial something. Or it's something that some people will find offensive. And the example that was given here, for example, on the Q&A, was that of abortion. So these are things that some people feel that they have a moral objection to, or something you shouldn't talk about in public, or whatever their opposition is. What is your advice when you are communicating in that area? Who wants to stick their hand up first?
Okay. I think I want to respond to this.
John?
Because 2 years ago, I was involved in a similar study with APHRC and Sapphire in Nigeria about abortion. And here, abortion is still is a case that is religious-wise, is not supported, even culturally, in that local community we went. So the method is that you need to be careful. You engage your respondents from the beginning, right from the time you are conceptualizing that study. You know, you look for the community leaders who you can educate about that situation. You look at the big sisters, some people they are in the community that they are respected. You know, you work together. Not that after you have done the study, you just take the study to the venue, bam, like that. You know, they will not accept it. You can be stoned. So the best thing is that you start gradually, systematically. You know, you engage them, the community leaders, the religious leaders in that community. This is what you are doing. This is the reason for doing this, and so on. So when the result comes, it would meet them unaware. So that is the experience I got when I was doing the work for APHRC and Sapphire. So it's a gradual process, and you engage the people in the community before, and they give them information, the true knowledge. Both religion, all the religion leaders in that community should be involved. Thank you very much, Sharon.
Karani?
Yeah, I would say that one is a lazy researcher when you don't consider that what you are going to be communicating has individuals who will take it very positively and those who will always take it very negatively. So that in scientific communication, you know, there are going to be the positive influencers and the negative influencers. You have to know how to handle this group. And I think John has elaborated that. You have to know how to handle them. For instance, and the example he used, supposing such a study on abortion was done by the 3 panelists here, and we took it out there. We haven't considered to include in that work the female gender. So as we advance this topic to the people out there, it is likely to face a lot of resistance. So in the conceptualization of the idea, the constitution of the people who are doing this, in terms of, you know, gender, in terms of sex, in terms of age, and such other factors, and also to sit down carefully before the work has even left your desk to consider, who am I taking this to, and what reception or resistance am I likely to face? And then you think about that prior. Thank you.
Kosiazi, anything to add in this area?
Thank you, Prof. I think John has touched on this, especially the issue of community engagement. I think that's where it comes in, and also understanding your context. So we cannot copycat. So if I understand the context, I will definitely know that within this particular context or setting where I'm doing or where I want to disseminate, this is still seen as maybe taboo, or it's something that is unheard of. So I will know who to approach. So if I do my community engagement very well, I will know, and I will get this information from the gatekeepers, and I will find a way of communicating that in a way that it cannot do any harm. Thank you, Prof.
I think what you've all three of you have said, that's very important, is that the notion of engaging people in research doesn't start at the end. It's not just with the findings, it's also right at the beginning in terms of what questions should I ask? How should I ask them? Who should I ask? Who should I include? So what nowadays I think the jargon for it is co-creation, so that we co-create our questions, our methods, and then there is a space where people want to know what the results were, even if they weren't results on a topic that they are in favor of doing research on. And I want to just tell you from my own experience. So in the lead up to democracy in South Africa, I was doing a lot of work on women's health, and obviously the question of abortion came up. And we never really looked at it from the point of view of abortion, because we knew that there might be some opposition to it. And so what we spoke about was avoidable maternal deaths, because everyone thinks and should think that it's an appalling thing to die in childbirth. to die because you're pregnant. But in fact, women who have unsafe abortions, for example, that's exactly what's happening to them. And so you need also to find a way to get those particular points across. And those of us who work in public and population health are often actually working on what they call unpopular issues, like inequality, like human rights. And then you will find people who believe differently to you, and you have to find a way to engage with them. And often it's in saying to people, I know we don't talk about this, but I want to find out if you spoke about this, what you would say, what you would feel. So those are some of the ways of trying to get they often call them the sin topics, I think, I can't remember, but you have, those of us who work in this area often are working in that sort of frame where there might be people who disagree. I wanted to go on a little bit to talk about the Conversation Africa. So for the people who don't know, the Conversation Africa is a publication, and it has offices in East, South, and West Africa, and their entire reason for being is to work with academics, people who already have PhDs and who are based at academic institutions or research institutions, to get their research into the public domain. And they publish it on their website called Conversation Africa. Have any of you written for the Conversation and had any experiences that you'd like to share in that process? Either three of you?
Yes.
Go ahead.
I have written for the Conversation Africa, but the article is yet to be published. Yeah. So, so what the experience, I think for me was just phenomenal. And I never thought it can be that difficult to rework my own work in a very simpler form. So, but I think the experience of working with a journalist and not with an academic was the one that was quite great for me, because even the words that I thought I have simplified, she will send it back and say, but what about this one? We're still saying some jargon here. We don't understand this. So, but at the end of the day, when I read the final piece that was sent, and I looked at the original, yeah, it was really, it has some very much clear developmental areas that I think I had really improved on. So it, I think for me, I found it as one simpler way of not really keeping this research or these findings in these high-level spaces, journal articles and stuff, but into some spaces where even people who are not really in these scientific spaces can understand what I'm talking about. So the experience was really quite a phenomenal one, because it was somebody who is also not an academic, a journalist, who wants to write a story. She doesn't want to tell them the science there. She wants to write a story, and I have to put it as a story. And yeah, it was tough to do it, but at the end of the day, when I read it, I could see that even somebody in primary school can just read and just get a sense of what I'm trying to convey. So it's really another way of communicating science to a non-science audience, which is very, very, very effective. And yes, I enjoyed the process, but yeah, it can take time. Thank you, Prof.
Yeah, it's often hard. Alison, I see you wanted to say something. Was it about the Conversation? Do you want to join us? Hi, nice to see you. Go ahead, unmute yourself and say what you want to say. If you're talking, you're muted. I wonder.
We could probably request her, Sharon, maybe if she's not available right now, I will request her to maybe post her question on the Q&A function.
Okay, But she is here. I'm not sure. Anyway, we'll come back to her. Karani, John, have any of you either of you written for the conversation?
I personally haven't, but yes, I am aware about them. And what drew me to try find out what they do is when I came across the divergence from scientific writing. So that is either scientific writing or conversational writing, and reading about them and how you simplify this, as Dube was saying, to a level that somebody with very low level of education can pick up. I have developed that interest, but I haven't given them any of my work, and I look forward, like Dube here, to do it and have it really synthesized to that very low and easy way to understand. So that's how it is for me, Sharon.
Same here also. I've not worked with them. And based on this, I will make sure I find out more about them. And there's something similar. You know, I've been interviewed by the Nature. Nature is one of the leading science publication writers, you know, in the world. When I was in Nairobi, I was interviewed about my activities in terms of research engagement that time. And I was so happy when I saw it being published. And that is one. And there's something similar to that as well. During my dissemination of one of the re-entry grants I got from Qatar, I was able to engage the press. I didn't really have, during COVID-19, what I did is I used a method by inviting them for a seminar on COVID-19, which you are one of the speakers, you are the keynote speaker, Sharon, that time. So they came in mass, both online and offline. As a result, I now disseminated my research work, and it was on the newspaper, about many newspapers, both online and offline. And the story was rewritten. When I saw the story, in fact, I can't even recognize, because they made it in such a way that like a prose, you know, making it more interesting, and the title was very catchy, you know. So that is the experience I had in that. Thank you.
I see Mary's from OAU, and she's also a Carter graduate, and she posted in the chat that she'd written to them, and similar to you and Kosiasi, she also says the thorough editing process, because that's what they do. They provide support to help. You know what they do? I asked them, they've got this, like, I don't know if it's artificial intelligence or something, but something that goes through literally the words you use, and you get a score for easy reading. And you have to reach whatever number that is. And if you haven't, you get it back. No, what's not clear here? What can we change? And the other point that Mary also made in the chat, John, which will be of interest to you, is the conversation is completely open access, and it's picked up by many, many news feeds. So you publish in the conversation and you find yourself being republished. They allow people to republish, and they republish in other media. They also give you accounts of how widespread your article has gone, how many times it's been republished. They can tell you on their site how many times it's been read. And there's also a space underneath it for conversation. So sometimes as an author, you're supposed to go back and see if someone says something that you can respond to. Olusoyin, can you unmute? Are you with us? No. Okay. So if you were giving someone who was becoming a researcher some advice, what advice would you give them around these kinds of issues? Like if you're gonna, okay, let me start. John, you're gonna give someone advice. What's your one word of advice that you'd say, you need to do this to be able to communicate your research findings?
Well, I would say that for you to get noticed and for your work to be to get to the right people, you engage the press, you engage the media from the beginning. The process of your work, let them know what you are doing. And apart from that, I will advise that whenever you also, after you have done your work, make sure you give it to somebody that is not in your line at all to read, if that the message is sinking or the message is understood or not. So if the person cannot understand what you have done, you need to rewrite, or you give it to some expert to make sure that the work can be written in a language that other people can understand. So engage the media from the beginning so that your work will not just end up in the library. And secondly, make sure that you use the right language. If you know that you are not expert to write it in a language that everyone can understand, get experts to rewrite the work for you. That is my advice. Thank you very much, Sharon.
Karani?
I would say, just like where I started, I will not explain it. Your audience. Who do you want to reach? For me, that's extremely key. I would also add, and I have also learned this when I have worked with people who have been there before. I have learned that when I have disseminated my work and incorporated a senior person in that line, most of whom were my mentors before, I would get better attention than when I come as a new entrant into the field and I want to call the media, I want to have everybody listen to me. They are more inclined to come in when there is a bigger name they know. Yes, I know I don't want to remain under the shadow, but that's the only way I'm going to slowly burn. And as they fade, my name will remain there. So for me, that has also been quite something that I would encourage any young person getting into research now. And lastly, it's always good to be very clear. What is the message? If you cannot tell the message in just one simple line, you have no message. You do not need to have a whole page or 5 or 20 to pass the message. If you cannot pass the message and in a very simple way to anybody and in just one simple line, so that if they're interested, they can now go to the details that you can always give later. If you cannot do that, then you need to rethink and sit down, sit back, re-strategize, and now go right.
I wanted to highlight one of the things you said, and I think you've said it in a few different ways, to be strategic when you want to communicate. And you've given us 2 examples. You said, take a celebrity, so a top runner. That person might have access you don't have. Or you've said, take someone who the media already know and let them bring you along. And I think you're right. Be sure not to be under their shadow. Own your own work, but be strategic in how you use them. So I think that's something we probably all should know. There are some people who don't like to share. Don't choose them. Choose the people who do like to share, but be clever about it. And Kosiasi?
Thank you, Professor. I would like to talk about maybe the issue of avoiding flying in and flying out with the data. Let's understand the context, the settings, the participants, and also the message that you want them to take home as the take-home message, and also the issue that what is it that you want to achieve at the end of the day? Do you want to affect behavior? Do you want to do whatever? So it has to be clear right from the onset. And where possible, like you say, Prof, collaborate. Let's not try to stand on our own. Sometimes it can, yes, take us somewhere, but in most cases, it will just keep us where we are. So let's collaborate where possible, but in a very strategic way. Thank you, Prof.
I wanted to also tell you something else that I had learned. And I was thinking about it, Karani, when you were saying either I didn't communicate well, or the journalist didn't understand me. And there have been a few times where it's been really important. So, for example, when we were doing quite a lot of research on gender-based violence, what we found was that the journalists often, in the way they wrote, almost reinforced norms that led to gender-based violence, and they were unconscious, really, of it. The other time that I had this experience was I was doing quite a lot of work for government, looking at funding in the healthcare system, and it's really complex. It's not so straightforward. And so what we landed up doing was we ran, as researchers, sessions for journalists. So we could also take some responsibility of making sure that journalists do understand our science. One of the big easy examples is the difference between a number and a rate. So that when you say there are 8 million people with X disease, but it's only 1% of the population, it's a very different kind of level of problem. And so that's one of the things that I also learned, is that sometimes you need to think about who the interlocutors are. There's you as the scientists, there's the audience, but sometimes the interlocutor is a journalist, and sometimes we have to engage with them. So, for example, when we did the health market inquiry, when the results came out, we had a whole 2-hour session first for journalists where we could explain what we found and why we came to the conclusions that we came to, so that when they did write about it, they could write it better. And I wondered if any of you had experiences of that. And then I'm going to ask people from the audience if they would like to contribute as well. So any comments from either three of you? Not essential, but if you have something. Okay, Mary, you had wanted to make a contribution. I wonder if in this format, maybe the audience actually can't unmute. Can they unmute?
When they unmute, they are taken automatically to the panelist section. So we don't encourage them to unmute, to just post their questions directly.
Let's go with this question on the Q&A then. How would you convey a message with the intention of winning the interests of a stakeholder who may inadvertently be embarrassed by some of your research findings? That smile makes me think, John, that you've got something to say.
I'm thinking, not now.
Okay. I'll tell you one of the useful things about being a researcher is what we can do is be very dispassionate and just talk about our methods and our evidence. And that's one of the ways of saying uncomfortable things. So let me give you an example. I did a lot of work in cervical cancer many years ago. And one of the things that happens if you can't treat cervical cancer is that the cancer spreads, and because of where your cervix is, it can spread into your bowel, into your bladder, and so you leak urine or feces. And people who have advanced cancer can therefore smell. And, you know, these are uncomfortable things to talk about, but if you place it within the anatomy and within the science of what you're doing, and you speak about it, that's my timer. I'm supposed to be keeping good time. You have to have the courage of your convictions, and you have that courage when you have a good research method that you know you can rely on to generate evidence that can be tested and be found to be correct. And I think that that's one of the ways of doing it. Another way of doing it, particularly when you have qualitative research, is to be able to have a quote. So you want to say something, you don't want to alienate your audience who are listening. And so it's not your words, it's a quote from one of your research subjects. My research subject said, and then you quote it. And you can convey a lot and open up discussion in many ways by doing those kinds of things. And that's what we have as researchers. We have evidence. And if we use that evidence, we can often open spaces, open minds, open discussions, and make things that are difficult to talk about possible to talk about. John, did you want to add?
Yes, just in line with what you just mentioned. We learned something when we were doing this policy engagement, that your audience scanning, we call it audience scanning or evaluation of your audience, is the key before you make that communication. So I believe that if you have done the environmental scanning or the audience scanning, you will know what the person you want to give that result to will know what is going to listen to or what it will be convenient for him. And even if you must even give something that will not be positive, you'll find a way of saying it in a way that the person will not be offended. And also the mood also is very, very important. Where you say this, you should be able to study and know where this person, maybe social gathering or a private place, so that the person will not feel offended. But if something is negative, you must still say it, but understand your audience and the environment. That's my input on that. Thank you.
It's a good point. There is something about humor that also helps. Karani?
Yeah, I was going to add that what I have seen happen in some of those very sensitive topics, especially when you want to disseminate results, I have seen people ask to consent participants from the work that they were involved in, that they could work with, so that you have one or two who work with you to those offices and they are survivors of whatever it is that you were studying. So that, for instance, if it is what Sharon was discussing, or somebody who has recovered from a fistula, vesicovaginal fistula, or those very sensitive areas, and you want to win stakeholders, when you come as the scientist and you are flanked by one or two of them who have been beneficiary of the work you are doing, that embarrassment goes and the point is taken home. But yes, I know it has ethical implications, but you are able to consent individuals for such, and you can ask for approvals from IRBs at the point of conceptualization of this idea that you are going to disseminate it using such an approach.
And obviously the person would want to come. There are many. I mean, in the HIV era, when HIV was so stigmatized, there were a lot of HIV activists who got up and said, I'm HIV positive. They saw it as their job to do that. And also, I think what you're describing, Karani, is that it's true, evidence can be very powerful, but also if we can make it personal, there's a real person that's had a real experience. So things like gender-based violence, rape, gender identity, if we can see the humans that are behind these numbers, that's also another way of trying to influence people, which I think can be very powerful. And then leading on also from getting messages across. John, you were talking about dance. One of the things that I've seen being used in many, many places is theatre, street theatre, community theatre. In fact, Kusiasi, I don't know if you've ever seen it, but we've had a big theatre, what was it called? At Wits, there's a group who went around I think it was particularly on HIV, Theatre for Life, that's what it was called. In fact, wasn't it from your department?
I think, yeah, the Drama for Life, Prof, and they
Drama
were showcasing across the campuses. Yes, yes.
Mm-hmm. And so those are also ways of getting messages across, getting people interested in ideas. So there are many different ways. And the other thing that I've seen is what they call edutainment, where scientists will be involved in like a TV program, like a soap opera, but the soap opera has got a backstory. So the front story is Mr. and Mrs. and the 3 children and something else. But the backstory is the one child's been abused by her father, or whatever, something difficult to get across. And they often work with scientists to try and work out how to communicate these difficult things, or it doesn't even have to be so complicated. It's I've seen it used for hypertension, very much because like you use the person who died in your group. Okay, so how many ways, what could have happened? And actually, they could have had a stroke, and we can prevent it. So I think there are lots of those kinds of different ways of presenting ideas. Any other comments? I've really enjoyed this conversation. Any other comments from any of you, or does anyone in the audience like to share some of their experiences? Mary, I know you're on the call because you posted a comment.
Can I say something?
Of course, John.
Yeah, about this edutainment, is very powerful. One of the study I did after my PhD is on the use of a Nollywood movie. Mm-hmm. Nollywood movie is the Nigerian-based movies that across Africa, even beyond, many people are watching. And I did some reviews, some work, whereby I look at the content of this movie. Is it encouraging risky sexual behavior, or is discouraging it? So we review more than 20 movies, and we saw a lot of things. At the end of that movie, we discovered that some of them are really, they are showing nude pictures. They are having sex without condom online, and so on and so forth. And I was able to do this. And apart from that, there's one movie which is very great. It's called Sugar. Sugar is a movie that cut across Africa. They started from Kenya down to South Africa. They came to Nigeria. It's a very powerful one that gives information about HIV and AIDS and how people can protect, run away from catching it. So you are right. A lot movie can do wonders in terms of communicating difficult information. Thank you very much, Prof.
Someone on the chat has also said that the point that you made, Nkosikazi, which is that it's important to translate into the local languages so that information is accessible to people in their own mother tongue. In fact, the comment on the chat just before that reminded me of a question that I did want to ask each of you to reflect on. And that is, you've all got your PhDs, you're at universities, you're publishing in international journals. Is this talking to ordinary people in ordinary ways? Is this something that should be the responsibility of universities to teach us to do, and of us who work at universities to do? I'll start with you, Nkosikazi. Is this a university person's job?
I think, Prof, it also depends what we see this university as. Because if I'm just in this university and I do this job and it remains here, what impact does it have? So I think when we do some of these, yes, I feel it is really my duty to also go out, share with the ordinary person what I have found and how that can also improve maybe a certain program or a certain behavior in the communities. But what I've kind of seen is that sometimes when we are in these universities, we kind of place our offices in the 11th, 12th floors where an ordinary person cannot access. And we start to be selective as well on who to mingle with. But when we want this data, that's where my problem is. We are ready to get dirty anyway. But when we have it, Prof, we kind of isolate and keep our offices very up there. So I think we do have a duty as a university that yes, it mustn't just remain within VETs, but it must reach all the different communities where this can make a difference and impact and also influence life in a positive way. Because if it's here, sometimes it's really helpless. We just have it in the libraries, then what? So yes, thank you, Prof.
Karani, any comments on the role of universities?
Yes, I think the universities should cause that what we study, what we find goes out there. But I want to approach it from a different front, Sharon, and ask, who is the university? Because we are the people who work in those universities. So I shouldn't wait for my vice chancellor to organize a forum where I disseminate this work or where I cause the university to do the work it's supposed to do, which is to change the lives of the community around there and the world over with evidence from research. So what I've chosen to do for me, myself, and I learned this after my PhD, I said I do a lot of work on fitness at various levels. And I learned that I am held high in my community because I work in a university. I can step down a little bit and work around in my town with young people. And I organized what I call Eldoret Fitness Fora for individuals below age 21 and above age 7. And I work a lot with them. And I learned that by working through these people, I disseminate a lot. They see me as this university don and all that, and they respect me highly. But I knew that by working with them, I am advancing what my university is supposed to be doing by impacting the community, the society. And I'll probably put this as I pause. Through that, I once got a child whose father is fairly senior with the policy issues and learned what I do a lot with fitness and all that, because I organize kids around and we do a lot of those activities, and in there do a couple of measurements, sometimes not for research, but for the knowing, although I have also done that for research. And this father to this boy, I think he was about 8 years old, got very interested in what I was doing. And this particular day, while dropping the child, chose to remain behind and to talk to me. And he was interested in, how can I help you make this even bigger? We haven't gone so far, but that was very encouraging for me. So we are the university. The university is not our vice chancellor or the big institution that we go to every morning. We are the university. Thank you.
John?
Okay, yes, thank you very much. Actually, that was a very good question. Whose responsibility? Other speakers have spoken, Karani, you'll be correct. Everybody's responsibility. But you know, university also should provide an avenue to make it possible. For example, Ibadan, University of Ibadan, we have a department, not a department, the office of the Deputy Vice Chancellor, who's in charge of research, innovation, and strategic partnership. And also we have a research office, whereby their own is to connect town and gown. As we said, we are far away, we are high there. So our work will not die in the library. You know, we should make it in such a way that we can connect. Now, having this office, the office has been doing very great work in connecting. Even there's a program every year, once in a year, we always have the kind of like a big program, like what they call it? It's like a conference.
Carnival, yeah.
Exactly. We bring people from town, you know, the medical people, traditional people, they came and they will come to campus, they will share ideas. is a good one. But however, we also need to create awareness, because if Dr. Karani or Dr. Dube, if they are not aware that they can disseminate, they can engage, even if the university has a platform, even money is available, they will not do anything. So all lecturers, all researchers, should be aware that we should engage the community. We should not just keep our work, just conferences alone. We should find a way of go and dance, to go and do things, go to the town and work. So awareness is very, very important. Thank you very much. Yeah.
The question, I was reminded to ask this question by a comment in the chat. So thank you very much, the person who made that that point. And Mary in the chat is supporting this. She said that she wanted to support that universities have a role to play also in building the communication skills of their graduates. And I think that is another aspect to this, that we need to I think, Karani, what you said is leadership comes from many places. It's a distributed function, and you can be a leader. You don't have to be the vice chancellor. And then we have to give people the skills to be able to lead, to be able to communicate. And I think that's the point Mary's making. The other point, I think it's also Mary saying that you have to provide a platform for the academic community to translate the research into what the general population, and it's not even just the general population. Sometimes social scientists, I read their work and I think, I'm sure they could have said that in English. I don't know what they mean. So it's also just across other disciplines even that we have to make ourselves understood. And I think that's where the conversation is really nice. And I know, Mary, you wrote for the conversation. So I think that that's one way where we could learn, because those journalists, as Kosiasi said, actually taught him how to write simply. I think the other point that I see happening in the chat is people are saying that the idea of dissemination has to start at the beginning of your research, not at the end of your research. And I think that's the point I was also trying to make when I spoke about this notion of co-creation, because sometimes researchers can be asking the question just a little bit off, and it misses the point that really hits home for people, or for policymakers, or for service providers. And so even being involved with the stakeholders who are going to be the people who are going to be affected by your research in the way you think through the research question and the methods is also very important. And thank you for the person on the chat who made that comment. I think we've had a really stimulating and fabulous conversation. I've enjoyed listening to all three of you. Thank you very much for the opportunity to spend some time with you. I think it's the most wonderful thing about Carter is that I get to meet young people across Africa and just watch them fly. And really, it makes me so happy. I can't explain to you. This is why I still write grant proposals in the middle of the night. So thank you very much. It's been great fun engaging in a little bit of a stilted way with the audience in the chat. I think we can end with the comment from the person in the chat who says, from Kikilomo, who says, I see that if we must embrace our role as change agents, it's important that we endeavor to find ways of disseminating our findings to stakeholders in simple, clear, and compelling ways. And I think that we all have a role to play in that, in how we design, how we teach, and how we communicate our research. And with that, I want to thank you so much for joining us. I want to thank the panelists for their contributions and the audience for engaging with us, and the APHRC and Carter Secretariat for making this possible and doing the background work. Enjoy the rest of your afternoon, and thank you everybody for what I think has been a very enjoyable just under 2 hours. Thanks so much.
Thank you, Prof.
Thank you and
Thank
bye-bye.
you very much.
Thank you very much. Thanks for the opportunity.